Today, we kick off our efforts to vaccinate every college student in the state of Ohio who wants to be vaccinated, and our goal is to do that this month, the month of April, just as we did teachers in the month of February. So Fran and I were at Ohio State at the Schottenstein Center today as we really kind of kick off this big effort. We had the opportunity to talk to a number of the students who are being vaccinated, and it's always interesting to hear, what they're saying. Some said they wanted to get their life back to normal. Some said they wanted to have a normal college experience. Some talked about their summer job that they were getting ready to go to and being prepared for that. Others talked about seeing their grandparents or somebody else in the family. So it's always good to talk to young people, and these were young people that were getting the shot for a reason, and they were very enthusiastic about it. So Schottenstein Center continues, Ohio State continues to do a very good job there. Fran and I have been, I think, to 19 different vaccination sites around the state, and yeah, each one is unique, each one is different, but they all are doing really a phenomenal job. And what's so impressive is the number of volunteers that we see there. So very, very, very impressive. Let's turn to our high schools for a moment in regard to vaccinations. This morning, I spoke to our local health departments, as I do every Monday morning. It's mostly listening more than it is talking. But I asked them to reach out to their local schools in regard to the vaccination of 16-year-olds, 17-year-olds, and 18-year-olds who are in high school. And we would like to get as many of them that want to be vaccinated, and would like to do it before school is out this year. So Pfizer, of course, is the only vaccine that can be used to reach the 16 and 17-year-olds. So we know that some of our health departments have already started on this work even before I talked to them today. Some of them had already made arrangements and were working with their local schools to do that. We also know that some of our children's hospitals are doing that as well, and we thank them. So we would also ask our other hospitals to reach out to the local health departments and to the local schools. And if there is a need for extra Pfizer that any of our providers are seeing as they're trying to reach our high school students and to vaccinate them at the school, then we would ask them simply to reach out to us, and we can talk about the availability of that Pfizer, because again, Pfizer is the only vaccine that can be used for those 16 and 17-year-olds. Again, our goal is the same as it frankly is with our college students, and that is to get as many of them vaccinated as we can before the summer starts. And once again, this is entirely up to the individuals. And in the case of the 16 and 17-year-olds, they will have to have, of course, a permission slip brought into school before they would be able to do that.